Hey, what's up, guys? Today we're going to go through the question and answer portion of the local first responder response guide for COVID-19 that our local region is using for law enforcement and firefighters. So if you want to check that out, I do highly recommend that you check the link and get the most current version of this because this stuff is updating very rapidly. But if you go to bit.ly/COVID911, you're going to be able to find the most current version of this document. If you scroll down to the very bottom or the last page or two, it's going to have all of these frequently asked questions and some answers that are all sourced. So I'm going to go through these with you. If you prefer reading on your own and just want to read these things yourself as the questions come up, feel free to skip this video, but some people find it helpful to have just a little bit of broader discussion about these questions. All right, so first off, what is this document? All right, well, this document is compiling the most current CDC guidelines. Almost everything that's on here, really everything except for I think there's one link that's World Health Organization, but everything that's on this is current from the CDC and it's updated daily. So everything that we're putting on this document for our first responders is updated regularly. If you've printed this out and you're using it in your vehicle or at your station and it's a couple days old, things have probably changed. So I highly recommend that you go to that link or use that QR code and see what is current. This is also intended for first responders. So while nothing on here is secret or, sensitive information, it is important to know that this information and the guidance that we're giving is intended for first responders. So if you are looking for what to do as not a first responder, then there are other sources that are going to give you much better information. Everything in here is really geared towards law enforcement and fire. If you're an EMS provider, there is a document that's almost identical to this, but it's geared a little more towards EMS, so you can check that out as well. Instead of the link there that ends in COVID-911, it ends in COVID EMS. So it's I have other videos of that if you want to go through that, if you're an EMS provider, but at least the frequently asked questions are almost identical. All right, so that pretty much covers that. Next question that we get a lot is, what is the most current information? Or is this the most current information? And if you are reading this from the internet and you just went to that link like I just told you to, then yes, this should be current with what is released by the CDC or World Health Organization or other reputable sources. Lots of things come out before the CDC posts it and verifies it, so it's not going to include anything that you just saw on the local news or you read about on Facebook. To make it into this document, it has to come from a validated source such as the CDC, the Health Department, World Health Organization, or something like that. So there's no objective things in here that it's just opinion. Anything that goes in this document, it goes in based on the review of several of our operating medical directors, so the doctors that are constantly reviewing this stuff, and they're going to put in the most current information into this document. So check that, but also if you are not a local provider with our organizations here in Southwest Virginia, then do make sure that they match up with what you're doing locally. So we can't set your policies and protocols. You've got to follow whatever you're doing locally. This is just what we're using in our area. All right, next question. What counts as a fever? So it can be measured, so we can actually check someone's temperature with a thermometer, or they could just feel like they have a fever. So don't feel like you have to have a thermometer and actual temperature reading. If they think they have a fever, they felt like they had one, that counts. So based on that, we are going to just assume that yes, they have a fever. If you go up in the document a little bit for us, we can look at what those actual numbers are, but again, those do change periodically. So let's see, fever. I don't think it lists one for the person, and it does for the provider. So making sure that you are okay, the temperature range we're looking at right now is 100. Previously, it was 100.5, and that shifts a little bit, but right now they're just saying 100 is the temperature. But if they feel like they have a fever, that also counts. So we're still going to follow those guidelines. What counts as a cough? This is one that actually was causing us a little bit of trouble at first because it's allergy season. Everybody seems to have like some kind of a little bit of a cough or a throat clearing. So the ruling on that is any sudden increase in cough strength, frequency, or production, like somebody that has the cold or flu, that counts. So the isolated occasional clearing of the throat, like from seasonal allergies or something like that, that does not count as a cough as far as our recommendations here. But if you're ever unsure, check with your supervisor, check with your infection control officer or whoever you have to make sure that you understand that. Next question, do I really need a mask? Yes, absolutely. A mask is critical. Mask is aside from maybe hand washing, a mask is probably the most important thing. So that's the absolute minimum. If you don't have a mask, do not come within 6 feet of a potential COVID patient without at least a simple surgical mask. There is some stuff out there right now where the CDC is kind of evaluating some improvised masks, and really that stuff is not great. That's if you do not have any other option, then maybe that's better than nothing. But still, if that's all you have, I would really avoid any kind of prolonged close contact. So a mask is critical. And also don't forget a mask on the subject also. So ourselves wearing a mask is important, but putting one on the sick person is just as important because that's going to prevent if they cough or sneeze, or even when they speak, it's going to keep any of those particles in and reduce the risk to us. So as soon as possible, get them a mask, and you should be wearing one too. Another question we get a lot is about N95 masks. So we hear about these all the time. Is it mandatory to wear a fitted N95 mask, goggles, and gown? The answer is kinda, mostly. Yeah, the CDC does suggest that you wear all of these things if you have them and if they're available. A simple surgical mask is appropriate if you don't have an N95 mask that is available or you haven't been fit tested for one. Fit test is making sure that it's the right size. There's some special techniques that a medical professional is going to do to make sure that you have the right size mask for you. So if you don't have a fitted N95 available, then a surgical mask is good. So we do want to do that. Goggles are important, especially if the subject is not wearing the mask or can't wear a mask. So, really the goggles or eye protection is to cut down on droplets coming from the subject. If they're wearing a mask, that does reduce that risk a little bit. So we still want to wear eye protection if at all possible. Of all the PPE that's out there right now, that's kind of still pretty easy to get your hands on, and that is something that we can actually kind of decon and reuse if we have to. So eye protection is a good idea. All right, next question. Will hand washing really help? Yes, absolutely. Hand washing is super important. We want to make sure we are washing our hands. More than any other recommendation, hand washing is the easiest and most effective way to prevent transmission. So whether we're dealing with a COVID-19 positive patient or a suspected sick person, or we're just out and about in our community, in our vehicles, in our homes, we're touching stuff all the time. Doorknobs, handles, steering wheels, shopping carts, everything. So the more you wash your hands, the better. Wash your hands regularly. Whether or not you wore gloves, whether or not you think you touched anything, you should just be washing your hands as much as possible. Hand sanitizer is good. You can still use that, but that does not substitute soap and water. Soap and water, at least good 20 seconds. Full hand washing is very important. All right, next question. Should I get tested for COVID-19? This is probably one of the most hyped things in the media right now is testing or lack of testing availability. And generally the answer is to the question, should I get tested for COVID? Usually no. The answer is kind of surprising and not what you would expect based on what you see in the news. But for the most part, most people don't need to be tested. It's not really going to tell us much. It's definitely not going to do anything to direct our treatment or care of you. really all that testing is going to do is after, right now they're thinking about 3 days is when that test starts to be more effective after your exposure. So they can test to see if you've been exposed, but really the only benefit for first responders is to figure out whether or not we need to continue that quarantine or self-isolation versus whether or not we can bring you back to work or have you keep working. So that's really where the tests come in. But for the most part, as far as treatment, that's not as important. One of the things that might be more important is testing the source. So if we have an exposure, if we can test the source or the patient or the person who is sick, then you, in general, depending on your protocols, you may actually still be able to keep working. And if we get that test back quick enough, that might be able to determine whether or not you actually have to go out of service. So follow your local protocols there, but if we can, we do want to get the source tested. All right, next question. Is my uniform contaminated? So in general, no. The CDC decon recommendations for first responders really focuses in on hard surfaces. So parts of your uniform could become contaminated, but you can wash those or wipe those down with an approved cleaning solution and wipes. So really any hard surfaces for law enforcement, you may need to wipe down your gun belt. If you wear a camera, you might need to wipe that down. Radio mics, radio, gun, pepper spray, anything like that is a hard surface definitely needs to be decontaminated after a potential exposure. But the actual cloth itself, generally not a big deal as far as contamination unless you have some kind of obvious contamination. So like, they cough, spit, have blood, anything that gets on it where you would normally want to take that off and wash it anyway. Yeah, you still want to take that off and wash it. But just in general, without any of those factors, then no, getting something or just being in close contact with someone doesn't take your uniform out of service. So just make sure that you do that. And also don't forget too, we can wear a gown. So if you have a medical gown or something that's protecting all those things, then even if you do get something splashed on that gown, you're going to take that gown off and everything under that is protected. Now, it's still not a bad idea to wipe stuff down anyway, and that's probably not a bad idea, but the fabrics of your uniform are not nearly as concerning. All right, next up, is my truck contaminated, or my car, or whatever you happen to be traveling in? So your vehicle, what do we do? In general, no, it's not, as long as we follow a couple little steps. So if we transport somebody in a police car, an ambulance, any kind of vehicle, then the decon for that is basically we first want to air it out and circulate air. So if it's something that has ventilating fans, turn those on. If you can do it safely, maybe even open the windows to let that ventilate as you're going. But definitely when you get where you're going, we need to air that out and let it get some fresh air and wipe down any hard surfaces. So all of the hard surfaces in there. In some of our vehicles, there are a lot of hard surfaces, so this may take a while, but we do want to make sure we wipe all that down. The CDC does not give a specific time on how long the vehicle has to be aired out. They might come out with something later, but right now what they're saying is the time to complete transfer of the patient to the receiving facility and complete all documentation should provide sufficient air changes. So basically for EMS, when you get to the hospital, just leave all the doors open and bring your patient in, turn them over to the hospital, do what you need to do, decon everything in there, decon yourself, whatever paperwork you need to do while you're still at the hospital. By the time you come out, you should be good to go ahead and decon your ambulance. And in that case, you're going to wipe down all of the hard surfaces. They do recommend full protective equipment when you do that, just because sometimes in cleaning it, you're going to get exposed to some of those surfaces that you're cleaning. So you do want to use the right precautions with that as well. All right, so next up, the question is my family at risk? So the CDC actually says no. So they recommend that, they don't recommend any special management of people exposed to asymptomatic people with potential exposures. So if you don't know whether or not you actually had an exposure, you don't know if they're positive and you're not symptomatic, so you don't have a fever, you don't become sick. There's not really any specific recommendations there. That said, you still want to use standard precautions and hygiene issues and minimize contact and exposure, but there's not any specifically higher risk for your family over others. Now, if you become sick, then that's a different story, but yeah, otherwise, no. And the last question that is on here with the frequently asked questions, where can I find more help? So what counts as medium or high risk exposure, and when can I come back after work? All of these questions. Really, this is something that your agency is going to have to answer because every agency handles that a little differently. So you're going to want to talk to your supervisor or your infection control officer and figure out whatever their protocols and policies are for that. Lastly, I'm going to scroll down here and just show you these are the sources for all of the documentation that came from all of those questions. So you can source them there. It also shows the date that documentation was either posted or updated. So as things change, so do the recommendations. So don't get mad at me if something has changed and you're watching this video from a while ago. Make sure that you're looking at the current information. Also, this information is provided for public education for our first responder community. It is not intended for the general public that is not first responders. Not that there's anything hidden or secret or important in this. It's just that there's different recommendations for you from the CDC. So we don't want you to be following these and to put yourself at risk. So make sure that you are looking at the appropriate sources if you're not a first responder. So props to Dr. Iki, LaPera, and Stanley for updating and creating this document. And, you can see right there on the bottom, this is copyrighted by them. So while we are doing this for educational purposes, please reach out to them or follow the link there at the bottom if you have any specific questions or need anything from them. All right, thanks, guys. All right, guys, thanks for watching. If you click subscribe, you'll get a notification every time we upload a new video with this topic. Also, make sure you check those links because this information does change rapidly. So check the links, you'll get the most current info. And if you have any questions, leave them down in the comments and I'll try and get back to you with an answer as soon as I can. Thanks.